On occasion of World Vitiligo Day, I, Dr. Shruthi H N, Chairperson of Social Media Cell 2026, warmly welcome you all to this today's special podcast, Vitiligo, Breaking Barriers and Ending Stigma. We are honored and delighted to have with us Dr. Vinay Singh, President of IADVL 2026. A warm welcome to you, sir.
Thank you, Dr. Shruthi, and a warm welcome to all of the audience and listeners and viewers.
In this podcast, we shall discuss what are the causes of vitiligo, what are the discrimination and social stigma that are faced by patients with vitiligo, what are the various treatment options that are currently available for patients with vitiligo, that is, where can dermatologists help them, and what are the common myths and facts that we should actually be able to burst in today's podcast. Through this conversation, we aim to raise awareness, foster understanding, and also to help to break the barriers and misconceptions which are associated with vitiligo. So, shall we start?
Yes, Dr. Shruti, this is wonderful that you have covered almost all the aspects, especially the myths around vitiligo and the social stigma which is there with the vitiligo patient, and the whole family is affected with that social stigma.
Yes. So, like we all know that all that is white is not milk. So, in a similar way, just because a patient has got a white patch doesn't mean he has got a vitiligo. So, can you just enlighten us about what are the different causes with which the patient can present to us with white patches?
Vitiligo, as such, is a whitish hue on the skin. According to the age, is different. Like I'll say that patients who are born with one small patch of white spot, it is not vitiligo, it is nevus depigmentosis. This is a condition where the melanocytes are not present in the basal layer of that particular patch of the patient. That does not mean that this patch will turn into white spot all of the body, vitiligo. But yes, of course, as the body size increases, that patch will increase proportionately to the size of the body in that particular part of the skin. Another is many of the children, school-going children, they come with some whitish patch on their cheeks. That is pityriasis alba. These are some of the examples which I am telling to the general public. We know as dermatologists how to diagnose vitiligo, and we try to diagnose it in front of the patient and pacify their fear that my child or my family member is having suddenly has developed vitiligo, and it is increasing very fast with this vitiligo patch, which is not vitiligo in many terms. There are very simple OPD measures by which we can diagnose and differentiate in front of the patient and make the patient and their families understand the difference between vitiligo. Because on social media, if they go, every white thing is labeled as vitiligo, and they are so much scared because of the social stigma.
Yes, sir. Thank you. So, it is very important to know that a child who has got a white patch since birth is usually not vitiligo. And in school going children, it is, especially in the younger age group, it is not very common. Like you rightly told, it could be just pityriasis alba, or it could be just a fungal infection like P. versicolor. So all they have to do is to consult a dermatologist at that point of time when they get a doubt whether it could be a vitiligo. Sir, could you please tell us in what age group can we find vitiligo more commonly? Like, is there any specific age which people need to be worried about?
Yeah, there is generally it is found, as I was saying just now, that vitiligo is found in almost all age groups. But the peak is seen, more incidences are seen in two age groups. One is the younger age groups, and one is the older age groups, which is recorded. These things are published, that there is a bimodal presentation of vitiligo. Some of the patients, they do not have vitiligo throughout their year, but once they reach into their fourth or fifth decade or even later, they develop vitiligo. Similarly, some are there in their adolescence and they start developing vitiligo or one or two patches, and then later, as they enter into their adulthood, they have a frank presentation of vitiligo. So it is found in almost all the age groups, but yes, peak is found in two age groups, which is C.
So we have two mode of onset of vitiligo. One is a younger age, and other is a older age group of onset. So
Right.
I think
Yes.
the most common thing that people are worried about, that is vitiligo hereditary. Like, especially a female, they are very worried that will she get married, because they are worried that the child will also have vitiligo. So can we just throw a
Of
light
course.
on what exactly is the incidence of vitiligo, or actually the prevalence of vitiligo in the society, and how common is this hereditary aspect of vitiligo that we can discuss now?
Yes, a wonderful point which you have raised. Hereditary vitiligo. Vitiligo is seen in some families. It is not hereditary that every offspring will have vitiligo in a particular family, or if parents are involved, every child will have vitiligo. It is definitely seen in running in some of the members of the family because of the reason that it is an autoimmune disease and it is controlled by, probably it is controlled by a gene which is passed on and then it is seen. There are certain families who come to all of us, dermatologists, where grandparents had vitiligo or they are having vitiligo, and the younger members of the family, they are also having vitiligo. But this does not hold true with all of the families. You're very right in saying that mostly the females, if they have vitiligo, they are more worried that their children will have vitiligo. It is not always true.
Yeah, genes do play a role, but actually,
Genes,
like you told, since it is an autoimmune disorder, not all children, not all the offsprings that she will give birth can have
yes,
vitiligo. That is a well taken point, sir. So it is very common for patients to ask us that, especially alternative medicine practitioners have asked them to avoid food, especially which is white in color. Like, I've had many patients who have told me, don't eat food, milk, and don't drink curd, don't eat sour items. So,
yeah.
what are the food that people with vitiligo should actually consume? So, is it food which is rich in antioxidants to be consumed more? And what exactly, if at all, any scientific evidence for food to be avoided? Anything regarding food and vitiligo?
Yeah, very good question, Dr. Shruti, because many of the members of the society, they feel and they think that eating white things like milk, curd, rice, and eating fish with curd, fish with pan, or similar things like sour items you mentioned, this will induce or increase vitiligo, which is not there. There is no scientific evidence. I'll quote one example here. If this was true, then all the coastal people will have vitiligo because their staple diet, many of them, they consume both the things, fish and rice. And most of the people who are in Bengal, they eat fish with curd, with pan. So this is a myth. There is no scientific basis about behind this. And a patient of vitiligo should have healthy diet, healthy food, should of course avoid smoking and alcohol and all the food items which are not good for the health, because treatment for vitiligo goes for a longer duration and the treatment needs requires health to be maintained.
So, food rich in antioxidants that can be consumed.
Yes, yes, that can be consumed. Yes.
Yeah. So, when person comes to a dermatologist, sir, is any particular test
Yeah.
required, or is it a clinical diagnosis most of the time? So that is when people are very apprehensive, so they want to confirm the diagnosis.
Yes, yes, absolutely right. See, the diagnosis is mostly clinical, but to reinforce the faith of the patient that yes, the patient is having vitiligo, we can do simple Woods lamp examination, which is very, very easy to be done. And I'm sure that most of the dermatologists in our country, they have access to Woods lamp in their clinics. It's a very handy instrument. And with that, you can actually show the patient that there is a possibility that the patient is having vitiligo with pityriasis alba and or tinea versicolor. So there is a difference between those two things that can be shown then and there in the patient. and doesn't require any blood investigation or anything else to give this reinforcement to the patient that yes, you have. Or you can also, if the patient is confused and you know that the patient does not have vitiligo, you can give them the faith that yes, with this test, we are not finding any evidence of vitiligo in your skin.
Yes, sir. So simple tests where non-invasive tests can be performed for that.
Non-invasive. Yes.
Dermoscopy, or like you told, wood slam can
Yes,
be.
even dermoscopy is very handy.
Yes, sir.
Yes.
So, what treatment options will you offer to patients who are walking into your clinic with vitiligo, and how do you actually counsel your patient? Because it requires a long-term treatment, and it doesn't go in a few weeks or months for that matter. You need a lot of hand holding for these patients, and it is
Of
definitely
course.
a matter of, a lot of months, I would say. So, how would you do counseling to your patients, and what treatment options do you actually offer to your patients?
Hmm. See, the counseling part is the most important factor in the management of vitiligo. Because if you are not able to counsel the patient and the caregivers in the family or the family members, then the patient will never ever be satisfied. Because we know that treatment, end goal of the treatment is repigmentation, which is not fast. It is not very easy to achieve within one or two consultations that the patient will have repigmentation, or maybe in few months. So hand holding and asking the patient first, during the first consultation only, to make the patient understand what is vitiligo, whether it is contagious or not. I never eat fish, or I never eat non-veg. All these are various questions which patients they shoot at us. So a clinician should give time and try to resolve all the myths which the patient is having, and also side by side telling the patient that you have to stick to only one therapy, whether it is a dermatologist clinic, modern medicine, or if the patient is they want to go to alternative medicines. I tell them you are free to go to any other practitioners. I have not read alternative medicine apart from modern medicine, so I will not be able to tell you how effective that is. You have to find a way. If you believe that yes, modern medicine will help you, then please, until and unless I say that now I cannot treat you, be on treatment and be regular on treatment. The treatment will include various modalities. We have so many things. So it all depends on the age of the patient, other comorbid conditions of the patient, and the distance from which the patient is coming to your clinic. All these things have to be taken into account. The most important thing is to make the patient understand that the patient needs care for a very long time by a dermatologist. This is very important.
What are the other topical treatment would you suggest for a patient with vitiligo with less than 10% of the body surface area involved?
Yes, yes. There are various topical agents which are available. Decapeptides are there. Sometimes we have to use short-term topical corticosteroids, very mild corticosteroids. Sometimes we have to use the immunomodulators topically also, which are newer immunomodulators like tacrolimus, pimecrolimus, or maybe JAK inhibitors also. So, and also we can explore if the patient can afford or can have a home-based PUA therapy if the patient is coming from a very long distance, or if not possible, then if the patient can go for PUA SOL, sunlight exposure after consuming medicine. So these are the management options for a patient who is having less than 10% of the body surface area involved. But the primary goal should be to stop progression of the disease first, and side by side we have to take into account of other comorbid conditions in the patient, and then we can gradually think about build up the patient's treatment for repigmentation, faster repigmentation. So this is how we should proceed.
If the disease is spreading very fast, or if it is a larger body surface area involved, so we definitely have to give oral medicines for such patients. So, what are the various oral medications which we have as
Yes,
options for vitiligo?
we have been treating with various oral medications which are available, including corticosteroids, oral corticosteroids, then oral azathioprine has been used, it has, methotrexate has been used, although these are very, very slow acting. Newer modalities of treatment are wonderful. Uh, Apart from certain oral medication which lead to faster repigmentation, which some of them are from Ayurveda also. Some of us they use. I have seen some prescriptions, but yes, we have good modalities of treatment like oral JAK inhibitors are there, which are giving wonderful results and very quick pigmentation, which is long lasting also, along with all the topical modalities of treatment which we are following. Again, the same thing that if it is very fast spreading or the body surface area is increasing, then we have to find the reason behind it also. Whether it is poor immunity in the patient, or the patient is having any other comorbid condition which is leading to autoimmunity in the patient against melanocytes. All these we need to take into account, and in that particular patient, we have to use accordingly.
Yes, sir. But oral JAK inhibitors has changed the practice of dermatologists when it comes to
It
vitiligo,
has.
with a lot of promising results seen, and it's
Yes.
given a hope to patients as
Yes.
opposed to what it was maybe a few years back. So, in this podcast, can we also highlight people? It's not just creams and medications which will help in vitiligo, but there are a lot of surgical options now. So,
Yes.
dermatosurgery is also a specialty of dermatology, and a lot of people are using surgical modalities as treatment of
Hmm.
vitiligo. So, can you just throw a light on what are the various surgical modalities which are used for vitiligo, like punch grafting and even a miniature grafting, and even for that matter you can also culture melanocyte cultures. So where should a person go for these kind of treatment, and which scenario would you recommend the surgical modalities for your patients?
The best patient for any of the surgical modalities is a patient who does not have a progressive vitiligo. The vitiligo should have stopped for at least 2 years. Then we can offer surgical options to the patients. Some of them you have very rightly mentioned, like punch grafting, miniature punch grafting, skin grafting, then melanocyte culture graft can be given, along with side by side other modalities, including derma rollers on the area where we have done grafting or melanocyte culture, or excimer laser over it. These all put together gives faster repigmentation and long-term remission for the vitiligo patient. So if first and foremost is the patch or the vitiligo problem or the disease should be a stable vitiligo. It should not be progressive. Second is you can try this in a segmental vitiligo, where only one part of the body segment is involved, which is non-progressive, which is not increasing, and it is difficult to give result with oral and topicals. There we can perform all these surgical options.
Yes, sir. Like you rightly pointed it out, the vitiligo should be stable, and also the patient should have a controlled disease. That is a foremost important point for considering the surgical options.
Yes.
So, and like you rightly mentioned, even
Yes.
segmental vitiligo, those are the cases where we can do it. So, what is that take home message that you want to give to all the patients of vitiligo? I think World Vitiligo Day is coming up, and Academy is having a program on vitiligo in Chandigarh. But on behalf of social media, I would like to tell the public that a separate sub page will be created for vitiligo patients. For exclusively their questions on vitiligo, which will be answered only by the SIG of vitiligo. So this is a great initiative by the EC. I would like to congratulate you for that, sir. So that will be launched on the World Vitiligo Day. Would you like to tell us about that?
Yes, the take-home message through our social media page, which is dedicated to vitiligo and vitiligo patients, is that you have a problem, do not have a fear, because having vitiligo will not lead to disability in your work. You can work as usual, you can swim, you can play, you can study, you can reach to whatever heights, you can even become the topmost CEO or prime minister or president of a country. So vitiligo is never hampering anything. Only thing is that being dark colored races, we are having a fear of white patches, which is only a fear. It is a this particular problem or disease, although it is and it is linked with other autoimmune diseases, it does not make the patient lie on bed or sit at home and do nothing. So you can do your productive work as you are doing. Take the right treatment from right doctor. Right doctor is a dermatologist, because a dermatologist is the only doctor who is having access to whatever is the new therapy for vitiligo in this world. So, and the dermatologist will give you all the options. And also, you need not stop eating anything. Whatever you like, you can eat, provided you do not have any other comorbid conditions which will need you to stop few things. So, and also do not hate any patient who is having vitiligo. People, they don't marry in the families, or they don't eat, go to their homes, especially in smaller towns and villages, which is absolutely wrong. Vitiligo does not spread by touching. If it was, then every dermatologist who touches a vitiligo patient would have turned into vitiligo patient itself. So it is not, it is a problem which can be very easily managed.
Yes, sir. Thank you so much for this. As we conclude this podcast, let us remember that vitiligo is only a difference in skin color and not a measure of person's worth, abilities, or potential. By replacing myths with knowledge and stigma with empathy, we can create a society where every individual is accepted and respected. Thank you, Dr. Vinay Singh, sir, for sharing your valuable insights with us today. And also, together, let us continue to spread awareness, promote inclusion, and celebrate diversity. So, it is a great initiative, and I hope this initiative continues with this podcast. I request all our audience to follow IADVL Connect, and all our dermatologists also to tell their patients to follow IADVL Connect with this regard. Thank you, sir. Thank you so much.
Thank you, Dr. Shruti. Thank you so much.
Yes.
Pacify their fear that my child, or pacify their fear that my child, or pacify their fear that my child, or
Surgery is also a specialty of dermatology.